All right. So whatever we were discussing last time, I was saying that you will refer to the oral medicine because even if you want to do biopsy, you cannot have a GP. So who is this person? Please mute yourself. Yeah. So answer is refer to an oral medicine specialist. I hope this is clear. Any questions regarding this? Clear. Very good. Next. She is aging and her root surfaces are more exposed. She's aging. So there is natural gingival recession happening. Natural gingival recession does not mean she has gingivitis. Naturally, it's recessing. Reduced manual dexterity means she is not able to clean properly. Raised compliance concerns with oral hygiene. What is the best to be done? So the question is saying the root is exposed. Oral hygiene is not there. So cavities will keep on happening. So what are you going to do about it? Brush thoroughly, floss and apply GC tooth mousse every evening. Not a wrong option actually, but is this the best option? Coat all exposed root surfaces with a low viscosity GIC, that is Fuji 7. Guys, do you know how many GICs are available? Who's not unmute? Please mute. How many types of GICs are there, guys? Quickly answer. 9. Very good. Robert, your question, what about xerostoma investri? What is that? I don't understand the term investri. Do you mean to say investigation of xerostomia? Dry mouth is xerostomia. Inventory. Xerostomia inventory, what is that? I've never heard this term before. Anyways, you mentioned me, what do you mean by inventory? Questionnaire form to assess. I think you don't have to do this. The question has mentioned she has arthritis. No? I told you arthritis is equal to steroids and steroid is equal to less saliva plus age, 72 years. It will cause decrease in saliva. Plus she's moved to a retirement village where the diet has also changed. So your questionnaire form to assess that has already been taken by the question and they said that the diet has been changed. The question mentioned it. So who's the one who's not unmute? Guys, it's really difficult for me to unmute you all. Just unmute yourself. Who's not unmuted? Who's the one? Okay, I can't find it. You all only unmute yourself. So coming back to the question, she's aging and her root surfaces are more exposed. So coat all exposed root surfaces with a low viscosity GIC. So yes, whoever answered, there are 9 types of GIC, that is correct. And Fuji 7 is the material that you would use to coat the roots. See, root is not covered by enamel. Root is covered by cementum and cementum is way, way rough. Cementum can be easily scooped out with a sharp spoon excavator also. So more deposits on cementum because it's not so smooth. More deposits mean more plaque is equal to caries. Caries is equal to problems. So cover with GIC. Why GIC? GIC chemically bonds to the tooth structure. GIC releases fluoride. It's easier to apply. It is less technique sensitive. And the patient is 72-year-old, may not sit for a long time on the chair. Understood? For all these things, GIC. Crown coverage, for how long would you keep on providing? I mean, you can't make the crown length this big, you know. You can cover till CEJ, that is cemento-enamel junction. You cannot go to roots beyond a certain extent. You will cause more problems. So crown coverage till the exposed surface of the root, not the right answer. Composite restoration, no, CI is composite basically, they are saying. Composite restoration on the root, you will cause sensitivity. You'll etch the root surface, you'll provide composite. Composite is mechanically bonding to the tooth structure. It is not chemically bonding. Mechanical bond can fail. Understood? Plus, it is technique sensitive. Meaning, if there is little bit of moisture contamination, also the composite will come off very quickly. which you don't want. And GIC is not so technique sensitive. It's water loving, it's hygroscopic. Learn the properties of GIC. Next patient is David, who's a senior manager, who has experienced problems of tooth wear for many, many years. He has good oral hygiene, a reasonably healthy diet with low frequency of carbs, but he has a taste for red wine. He loves red wine. He appears to have reduced salivary flow, so he has reduced salivary. And the buffering capacity of the stimulated saliva is unusually slow. So you see, 2 tests have already been done, and the question is telling you what is the best advice for him. Stopping a judge in the red wine testing. Well, we don't know if he's a judge, and even if he's a judge, you're going to stop him from doing his job, correct? Eat several pieces of cheese after drinking red wine. Kind of correct answer. Wait at least 15 minutes after wine consumption before brushing the teeth. Well, you should wait at least 1 hour after drinking wine for brushing the teeth, so that is not the right option. Eat several pieces of cheese. Why cheese? Cheese is high buffering capacity. Its pH is high. It will neutralize the acids. Plus, it has calcium. So it will replenish the calcium. It will neutralize the acids from the wine. So in the following 3 options, this becomes the right answer. I don't know what the other 2 options were. You see, it's really, really difficult to get the right questions, first of all. Arrange them. Find out the right options, then find the right answers, which are logical. It takes a huge amount of effort to prepare any mock. It's not like I have it like this. I have spent hours and hours researching so that I can help you all. Why I want to help you all? Because when I was studying, not only for this exam, since my childhood, a lot of exams that I've given, I had very minimal guidance, which I kind of regretted, because if a proper guidance is given, I feel even an average student can reach good heights in life. You understand? So I want to provide good guidance so that if only the guidance is stopping you from achieving the dreams, let this be the guidance. Then you do your hard work and achieve it. But you should not feel there was nobody to guide me. I am there, many people, others are there. Use the right guidance, So that is why. Anyways, so eat several pieces of cheese after drinking red wine. Understood? And coming to the last question for today. Last patient for today is Martin, who has good oral hygiene. Again, his diet is relatively healthy with minimal snacking and good water intake. He does consume 1 to 2 black cola drinks per day. However, this is usually during the meal times. Meaning, see, during the mealtime, whatever you have, everything is washed away. So that means you're not having in between the meals. During meal times, okay. And the regular use of fluoridated dentifrice. Martin is a low caries risk. The question is saying he has good oral hygiene, diet is healthy, low caries risk. What is the best protection? So if the patient is having everything good, what will you do? Just because he has come to you with oral examination and everything is good doesn't mean you have to do something. You can be a good dentist and tell him continue to do whatever you are doing and come for regular follow-ups. You don't have to poke and unnecessarily do something because he came to your clinic. Understood? No additional protection or prevention strategies are required. This would be my answer. If everything is going fine, I will say continue. Chewing a CPP, ACP containing sugar-free gum after every snack or meal. I can tell him you can chew the sugar-free gum. But does it have to be after every snack? No. Once a day, fair enough. Twice a day, fair enough. After every snack, no, I cannot impose that. Chewing, okay, a purpose designed splint will be constructed to minimize the effects of tooth wear. Splint, why? Where is the tooth wear mentioned here? Tooth wear was mentioned where in the previous sub question, remember? When there was this other manager of the red wine, he had tooth wear. This patient is not having tooth wear. So, but because we're in the flow of the question, this option is trying to trick you. Your mind can go to the previous sub question and you can get confused. That's why your alertness matters in the exam. There was a time in my exam, you know, when I was in the last two questions and my mind was so like zapped, as in I was exhausted, that I actually sat like this, timing myself for 30 seconds, closing my eyes. Because I wasn't alert anymore. I was like, question after question is coming, and I really don't know what to do about this. You get it? So you can take a break in the exam for 30 seconds or so, but not more than that, because then it will screw up with a lot of things. I will just save this somewhere here in ADC part 100 and exam, or ADC, or my ADC course. Yeah, I will just save the recording here. Where is this? Oh my God, there are so many screen sharing buttons here. It's really confusing. Anyways, so start routine use of high fluoride containing dentifrice. He's already using a fluoridated dentifrice and he's doing a pretty good job at it. So why do you want to go and give him a higher fluoride based dentifrice? You don't have to. Answer is no additional protection or prevention strategies are required, but you can motivate the patient to continue the oral hygiene the way he is doing. Understood? So thereby I end the session. Any questions, please ask right away. Can we give CPP, ACP to the patient if the patient says no for fluoride? Yes, you can, but then read the question properly. If the question says the patient is having dairy allergy, which was asked in my exam itself, you will not give CPP, ACP. Understood? Any other question? So these were nice questions. I just finished making the paper 3, which I will release to the enrolled candidates today or tomorrow. They have very nice questions, the paper 3 September paper. I don't know when we will reach to that because still we have to finish the paper 1. They have really good pedo endo related questions where I'll be teaching a lot of concepts about pedo and endo. I'm waiting for that paper to probably in Feb and March we'll be coming to that, I guess. So is the cheese to neutralize the pH? Yes, it is. Yes, it is. So my suggestion to all the candidates is solve this paper, the September 2022 mock 3 to 4 times. High chances of similar questions being asked, not the same questions, okay? ADC is not. Similar questions being asked. Allergy to fluoride varnish, how to prevent this? Well, honestly, I have not seen so much allergy to fluoride, but to prevent, don't use fluoride. See, fluoride is present in so many things. In tea, there is so much of fluoride, and various other food materials that need so much fluoride. But if there is a proper allergy to a varnish, don't use fluoride, use a dentifrice, or just skip fluoride altogether. There are fluoride-free toothpaste, there are fluoride-free everything so much. Which topics to cover in ortho? Canine impaction, simple points, skeletal malocclusions, class 1, class 2, class 3, dental malocclusions. There was a question asked in my exam. They had given an OPG and they have given a LATSEP, which was like this, you know, class 3 profile. And that they had asked which type of malocclusion is this. So those kind of questions will be asked. Apart from simple questions like ankylosis, nothing major on fixed appliances, nothing major on removable ones, but referral to ortho in what case, all these kind of questions. Various type of these questions are mentioned in my mocks. So when you come across a question, do a lateral study, meaning, for example, if a question is based on, say, indirect pulp capping, read more about it, read more about direct pulp capping, read more about pulpotomy. This is called as a lateral study. You understand? Since ADC asks only clinical questions, now you recommend to follow theoretical questions as reference. Read or please suggest what is good to study. See, there was one question here which I said is not based on scenario-based question. It was a basic dental question. Remember the last question of the first SBQ that we discussed today, it had got nothing related to the scenario-based question. So at least 15 to 20 questions in ADC would be asked on basic theory. But it would be something which you have already read. It's only your concept has to be cleared. For example, they might give you a question based on there is caries close to the pulp and what all material which you use for IPC. There'll be options like, you know, calcium hydroxide, Metapex, zinc oxide, eugenol, GIC composite. The answer is calcium hydroxide. If there was MTA, that could have also been an answer, but suppose MTA was not given an option and you chose calcium hydroxide. The next question can be calcium hydroxide can be used in all of the following conditions except, and then the options would be, direct pulp capping, an immediate fracture to the tooth exposing pulp, direct pulp capping in a primary tooth. Now that becomes the answer. Calcium hydroxide cannot be used as a DPC in a primary tooth. You get my point? It's contraindicated because it causes internal resorption. So this question is not related to my scenario-based question, but it's a basic dental question. These kind of questions you will definitely get. In fact, 15 to 20, I'm understating this. Out of 280 questions, at least 50 to 60 direct questions you will be getting. Is it contraindicated to replant EVAS 2 in immunocompromised patient? No, it is not contraindicated. Shirley, your way of explanation is amazing. Thank you. You're welcome, dear. I'm glad you are understood. I have made some interesting explanation on a lot of things. TMJ, again, I would be discussing in paper 3, but I think it would be by March that would be discussing paper 3. You see, 3 questions consume 1 hour, but the concepts are clear. So when you start solving it, you'll be happy about it. So my suggestion, solve the links, take the mock test. Whichever course you have taken, make sure that mentor is giving you at least 600 to 700 questions in your mock test. The mock test only is going to get you through, apart from your basic concepts. So yeah, that's it. I end this. I'll save the recording and I'll share to all the enrolled candidates. So I'll see you all next Monday with question numbers 10, 11, and 12. All right. Thank you. Bye-bye.